Alrighty, so we got Medicare for all debate. Ben versus Carl. Ben is posing it, and Carl wants it. I don't know. I don't host debates. I guess let's get started. And if you guys have opening statements.
I don't have an opening statement, really. I was just going to say I believe that Medicare for all is not moral, it is not cost-effective, and it is not good for the quality of healthcare.
So I think that that's really interesting because I disagree on all 3 points, as you probably expected. I think that it is cost-effective. I think that it's incredibly moral. And I think that it would increase the outcomes of our healthcare system. So do you have, where do you want to start with cost?
Yeah, if you want to. Whatever you want to start with, go ahead.
All right, so I believe that Medicare for all is incredibly affordable. There are some studies that say that it's cheaper than what we currently spend, and studies that say that it's more expensive than what we currently expend. I say, well, we'd be covering way more people, and we'd be providing more to people. So I think that it's incredibly affordable, and I'd like to hear your objections to that.
Well, what are you referring to exactly? Like, I would need to see some proof that it's more affordable.
More affordable? Well, for cheaper than what we're currently paying, there's a Lancet study that says that. There's the PLOS study that shows 22 different studies that say that it's cheaper than what we currently spend. Now, that's cheaper than what we currently spend.
Okay. So, first of all, the Lancet study, that's a very discredited study. I didn't know people still cited it. So I have a couple of things on the Lancet study. Like, I will go ahead and send you this. This is from PolitiFact. Is this?
I'd be happy to acknowledge that the Lancet study is on the lower end of the spectrum, but as I said, I have 22 other studies. I'm sure you're familiar with it. The meta-analysis that show all of them show that it's
the POS meta-analysis. I actually have it pulled up right here. I think, okay. Or I can pull it up. It's for somewhere. Sorry, I have a ton of tabs pulled up, and I know I just had the meta-analysis pulled up.
Well,
okay,
I mean, what are your objections to the meta-analysis?
Yeah, I'm just gonna read right off of it. So we're gonna go right here. So this is quote: "We did not apply quality rating scores for the included economic studies." And I'll stop right there. So a meta-analysis that does not do quality rating is like the worst thing you can refer to. Like the whole point of a meta-analysis is to use quality studies or to weed out bad quality studies and to take like the average. And another issue with this is they purposefully excluded over 35 other studies, and they just chose these 22 studies. I've heard this
said a number of times. Have you ever seen these actually 35 studies? I've heard this said by the American Health something. I've never actually seen these 35 studies. Do you have them?
I have several of them. I don't have all of them because they're just like they're spread all over the place. But I have several.
I've never seen this number actually cited all at once, and I've never seen. Now, it's very common for a meta-analysis not to include every single study that's ever happened in the field. These are 22 studies that all show that Medicare for all would save money.
Right, but you have to have a high quality study. I couldn't care less if there's just a study. You have to have a high quality.
Could you tell me what's wrong with these studies?
I can find. Well, I mean, can you tell me what's right with these studies? Like, that's the whole point with the.
No. There were studies put forward. This is a very reputable organization. I want to know what your specific problems are with these studies.
A very reputable organization.
Well, you're saying that we shouldn't believe this, and I would like to know why you're saying.
No, I'm saying we have no reason to believe it. See, if you're presenting evidence, you have to give me reason to believe it. I have no reason to believe it.
Just because it's meeting this standard that you've decided not to adhere to. I'm asking why. I'm asking why it matters.
No, this is a very common standard in academia where you
that's a bit of
quality control.
I'm asking. What is something that you have a problem with any of the studies? Can you tell me anything specific that you have a problem with? No, you can't. You just disagree with them, and you don't want to.
Carl, so here's the thing, right? So we're debating on we're debating on Medicare for all, right? So you're taking the positive. You're taking the positive. You are taking the positive position. The burden of proof is on you. So when you're saying, "Oh, there's a study that exists," and you haven't even read these.
I have it right here. I have
You
it
haven't
right
read these
here in the
22
study.
studies.
Exclusions were due to inadequate technical data or assuming substantial role for private insurers. That is why studies were excluded. So we have it in the data that they excluded certain studies for certain reasons.
Wait, where are you reading that from?
It's in the methods section. It's right at the top.
Have you actually like read through this whole thing? And have you read any of the studies in there? Because I don't know why you expect me to believe these 22 studies just because they are studies and they exist.
What study are you comfortable with using?
I have several. I have
there's 23 studies now that you've said you're not going to use. You can't tell me why, but you're going to say that we can't use them. What's a study that you?
I have no reason to use them.
Okay, then what's a study that you're comfortable using?
So I have one from Rand Corporation that says
the Rand Corporation, the one that said that it would let's see, it'd be $4 trillion extra over the next 10 years.
It would increase 2% in the first year of Sanders' program, and then 10% after the first year.
That's not what it says. It says 10 years is the high estimate.
Huh?
That's not what it says. It's looking at the first year. The low estimate is 1.8% increase. The high estimate is a 9.8% increase.
U.S. would increase 2% in the first year of a Sanders-type program. That's assuming that the medical system would be able to meet 50% of the new demand for health services under a free system.
Yes. I just said
the demand were fully met.
I just said you misquoted it. It's not 10% over the next years, over the next 10 years. That's not what it says.
No, I didn't say over the next 10 years. I said over the next year.
Okay. So there's a range. It says 1.8% and then 9.8%. Are we disagreeing on that?
The 1.8% is assuming you would only be able to meet 50% of the new demand for health services.
Okay, you were the one that said 1.8%. I was putting it into context. You said 10% over.
No, I literally never said 1.8%.
Well, then why did you bring it up then? You said that number, didn't you?
No, I literally never said that number.
You never said the 2% number.
I said, well, I was reading the whole thing. Okay, so I said 2%, but I was never saying it's just 2%. Like you didn't let me finish.
Okay, and so that study, if I'm not mistaken, it says $4 trillion is what we'd increase in national healthcare spending over the next 10 years.
Well, it's 10%, so
4.2 trillion,
I guess. 4.2 trillion over the next 1 year. So over 1 year, we're spending what, half of our GDP on about half our GDP, which is like 7 trillion. No. So
that study that you're looking at, it says we currently spend 3.8 trillion. That's what the status quo spending. The status quo spending would be spending is 3.8 trillion. That is the source that you're using.
There it is. Yeah, so it says right here that it would be more.
No. I'm saying the status quo spending is 3.8 trillion, is it not?
That's what it says on here, yes.
And then the high estimate is 4.8 trillion or 4.2 trillion, correct?
Yeah.
So that'd be a 4 trillion increase over the next 10 years.
Okay.
All right. That is incredibly affordable. That's significantly less than what we'd spend on the military over the next 10 years.
So you think spending more money on healthcare is more affordable?
It is. We would be covering substantially more people, and we'd be the people that are underinsured would now be fully insured. And say it's substantially less than what we currently spend on the military.
Yeah, we currently spend around 700 billion a year.
Yes, and so over 10 years, that's 7 trillion. This is saying.
Are you assuming we can cut down? Are you assuming we can significantly cut down our military spending?
I think that that's very reasonable. I think that if we had an administration that could implement a Medicare for all system, I think that that's very likely an administration that would also be able to cut down on military spending.
Yeah. So how much do you think we'd be able to cut it down? Because it's 700 billion. Like there's not a whole lot. I mean, I'm for cutting down military spending.
I mean, so to meet the needs of the study that you just pointed out, we would have to cut it by, what is that, like 50, 55%, 60%? We spend more money on the military currently than the next 10 countries combined. I think that it's very reasonable to think that we could have that big of a decrease in military spending.
That's not nearly enough to.
That's what we just said, that it would cost 4 trillion extra over the next 10 years. Did we not just agree on that?
Yes.
Okay, and so that is substantially less than what we currently spend on the military.
Right, but we can't take all of the military funding.
And I'm not saying we need to take all the military spending.
All right, how much do you think we should take out?
Over the next 10 years, it'd be 7 trillion. It's currently, that's what we currently would spend on the military. If it stays where it is, we currently increase it every year. But if it stayed right where it is, it would be 7.3 trillion, 7.4 trillion over the next 10 years. This study, the RAND Corporation, which is, if I'm not mistaken, a conservative institute, but that's fine. We're using these numbers. That's 4 trillion. That would still leave 3.4 trillion on the military over the next 10 years. I believe that would still put us at the largest military in the entire world.
Well, I mean, you think if we cut down half of our military, we would still have the largest military in
We
the
spend
world?
more money on the military than the next 10 countries combined. And most of them are our allies. But yes, we spend more money than and I also don't think
but the size of spending doesn't necessarily coincide with the size of the military. Because, you know, like you have manpower,
we spend more money on our military than the next 10 countries combined. We're talking about spending, are we not?
Right, I know.
And I'm saying that we can cut spending by that much. You're saying cut the size. It seemed like we were colloquially using them as the same thing. If you're talking about the actual size, I mean, I don't see how that's relevant.
The reason we spend so much more isn't because we have a bigger military. It's because we have so many people in different areas.
I know, and I'm saying that we can significantly cut down on that.
Yes, we could. Do you think we could cut down half on that? Definitely, and then put all that money towards Medicare?
Consider it. Well,
and then you're assuming
what we should do, is it not? This is what we should do. I think that it's very reasonable to think that we could cut down the military that much when you look at what military spending for the rest of the world is. And now this is to still keep us at the top, mind you. This is, I mean, I don't think it's that important that we have the biggest military in the world.
But can you demonstrate that we can cut it down half?
What do you mean? Can I demonstrate? What do you ask?
You're just saying it's reasonable.
We could close down we have military bases in over 100 different countries. Of course, we could close those down. That would greatly increase. We could end all the wars that we're involved in. What are you talking about? We can't cut down that spending.
No,
immediately withdrawing from the Middle East would cut down.
I didn't say we can't cut down that spending. I'm asking you to demonstrate your claim.
Ending the wars that we're currently involved in the Middle East would cut down that spending.
Like what? Like what war?
What are you talking about? We're in Afghanistan, we're in Iraq, we're in Syria, we're in, I believe we're in Somalia. We're currently arming the Saudi Arabia and a genocide in Yemen. What are you talking about?
So are you aware of like the cost of each one?
Or are you sure we could look it up. I know the war in Afghanistan cost several trillion.
Yeah, over the course of years. Like, I mean, I don't support years, and I support cutting military spending.
Well, then
I don't think I can. You're just at face value assuming that we can cut it down 50% with no issue.
I mean, what issues do you think would come up?
Okay, you know what, let's ignore the military spending. Let's assume we can get the military spending for the sake of argument.
All of a sudden it's affordable.
So I'll assume we can do that. So
and that's just military spending. Now, that's not increasing capital gains. That's not increasing taxes on the wealthy. That's just if we take what we're currently spending. Yeah.
Now you have to assume you're going to actually raise all the other money to the government, right? Because this is the money we're going to be spending through both public and private over the course of this many years. So now you're assuming we can get all of that money and transfer it to where it's going to the government and then to healthcare.
I think it's very reasonable to assume that when we can look at the fact that we're already spending that money on healthcare. I'm assuming that you're going to say it's going to have some like hurt GDP in some way, but we're literally already spending that money on healthcare.
Yeah, but do you have like a tax plan in mind?
I believe that Bernie Sanders put a tax plan forward. I don't think that it went far enough, frankly. I've seen estimates.
Yeah, his tax plan was assuming the Lancet one was correct, which it wasn't.
Okay, but regardless, if that's the money that the country is currently spending on healthcare, I see no reason to think that we could not then accumulate that money through. I mean, this is state spending that's already happening. That's where a large amount of the cost is already coming from. So there's no reason to think that we wouldn't be able to obtain that money through taxes when that money is already going to healthcare.
Mm-hmm. All right, let's go to a few of the other ones I got here.
I'm going to need you to address. You brought up the RAND Corporation study, and you said that it would be unaffordable because of that. I mean, are you saying that you were wrong about that?
No, I never said that.
Okay, well then I'm asking why are we moving away from that? I'm saying just military alone, we spend more on that.
I'm not. I was going to the other studies.
Can we talk about the one you brought up?
We're just going through that one cost, right?
Well, that's just military spending. You said that it would be unaffordable because of this study. I mean, are you throwing out that study? Because if you're not, I'd like to stay on it.
No, I'm not. I'm just going to the other ones. You brought up 22 studies, and you won't even let me bring up 2. Like,
okay, we'll bring up the next one.
Why does it work like that? Like, so I was just going to say the Mercatus one was $32 trillion in new spending over, I think it was over 10 years.
That's correct, and I believe that one now. I know that people don't like to use that one, so I don't know why you brought it up. The guy has literally come out later and said not to use his study. Now it said that we would save money with the Mercatus study that you're referring to.
He said don't use it to say we're gonna save money.
Even I mean that's what the study explicitly said. If you'd like to use what he says in the study, then we would save $2 trillion according to the Mercatus study.
Okay, where is this right? I'm gonna read this. All right, so this is literally what it says. Under conservative estimates, increased federal budget commitments by approximately 32.6 trillion during its first 10 full years of implementation. Now, at one point, it does show this this stat where it's basically got these different scenarios, right? And it shows one scenario where it saves 2 trillion, but that's assuming that Medicare or healthcare providers will have their compensation cut down by 40%.
It would take Medicare rates.
Healthcare providers, I misspoke, not Medicare, healthcare providers. So he asked people to stop using it to say it's saved because they were just cherry picking.
You just used the 32 trillion number, did you not? That is the conservative number. Why are you saying that we shouldn't use it when you literally just used it?
What?
So that's not what I said. The 32 trillion number, did you not?
Yes, because that's the number.
What does he say is the current national spending in that study? Over the next 10 years. What does he say the national spending would be over the next 10 years with that study?
Just a second.
It says we would save 2 trillion with that estimate, the 32.6 trillion.
No, it's okay. So he says the spending will be about 32 trillion. Right.
But what does he say national spending?
So you're saying the 2 trillion in savings, where it's.
It says we're currently spending 34 trillion over the next 10 years. Does it?
Right. Okay. 34. There you go. So you're saying it says it's saving 2 trillion.
With that,
but the 32 is 32 on top of the 34.
That is not what it is.
Yes, this is literally what it says. Like if you just like literally read, like it's literally in the abstract, I think. Like right at the top.
No. That is not what it says. So you're claiming that people are taking that study, saying that it will cost 32 trillion on top of what we're currently spending, and people have taken that to mean that we would spend 2 trillion less?
Yes, that's exactly what you did.
The objection that he has to that study is that people are taking the 32.6 trillion, which is the conservative number, and people are saying that would save 2 trillion. When he's saying that it would probably cost more than that. Now, why would we still have wait. You're saying it would currently cost 34 trillion. Why would we still have all of those costs with a single payer system? Why wouldn't those costs go away?
It says it would add 32.6 trillion
to public spending. To public spending, does it not say that?
To federal budget commitments.
Exactly. That's what we're spending federally. Now, if you take all the other money that we're currently spending on healthcare, when you look at national spending, then it would be under the conservative estimate, 2 trillion cheaper. At no point does he say it would add 32 trillion to national spending. Now, this is super important because we're already paying money for healthcare. The nation is already paying money.
Yes, I know that we're spending half our GDP. I'm trying to look at you keep getting me very mixed up because you're mixing around all these numbers, and I'm trying to actually find the actual.
Okay.
I'm trying to find the actual.
He said that the number would be what, right 66 trillion? Is that what the nation would spend on healthcare? That's what you just said it would cost?
Where is that one article? Where did I put it? I'm trying to find his op-ed where he talked about how people were misinterpreting.
We can just look at the study. Does the study not say that it would cost 32 trillion for federal spending and that the current national spending would be 34 trillion? This is the study that
I'm trying to read it. I'm trying to read it.
I didn't come with the study. You came with the study. And you don't be familiar with the numbers.
I'm trying to read it, but I can't read it.
I've read it before the debate, frankly.
I have read it before, but now you're saying all this stuff that's confusing the heck out of me, man. Like you keep misreading. I say something, and then you say the exact opposite of what I just said, and now you're mixing me up. I don't even know what I'm supposed to, like, how am I supposed to even stay on track? If I bring up a number, and then you're like, oh, you said this and this and this, stuff I didn't even say. Like, I don't know if you're just, like, is my mic okay? Are you just like mishearing everything I'm saying?
Could you actually talk about the Mercatus study? If you need to read through it as fast as you can. But
honestly, I don't even want to stay on healthcare spending right now, like at this point, because I'm very tired of saying all these numbers and you getting them all mixed up.
No, wait a second. Now we can talk about the rand one.
So,
we agreed on the rand one.
I will be nice here. I will assume. Wait.
I want you to be mean.
I'm gonna be nice. I will assume for the sake of argument, just because I'm very annoyed on talking about all these numbers, that it saves money. Okay.
Frankly,
I'm gonna assume that
it's debate about numbers,
or that it's the same cost. Yes, I was ready to talk about numbers until you started putting words in my mouth and stuff.
Let's talk about the RAND study, the one you cited. Let's talk about that one.
We already talked about it.
Are you familiar with that one? Okay, and it said $4 trillion over the next 10 years is what it would increase by, right? Is that not what it said?
I literally do not care at this point.
Well, this
is annoying me a lot. Like, I just want to have this is just annoying going over all these numbers and talking about maybe we can get this amount, or maybe this study's right, maybe this study's right. Like, let's just
debate of healthcare would look like.
This isn't even my main arguments. I didn't even want to talk about cost that much.
Well, it seems like you had some sources that you were.
Yeah, because I knew you were going to bring up costs.
Okay, and we brought up cost, and are you conceding on cost then?
Yeah, for the sake of argument, I'm going to concede on cost because I literally don't care either way.
Well, that's interesting. All right, well, let's talk about the outcomes then.
Sure. The
United States has terrible outcomes when it comes to other developed nations.
For example,
let's see. So this is from the Commonwealth Fund. The U.S. has the lowest life expectancy.
Okay, I'm going to stop you right there. So life expectancy is one of the worst ways. Not one of the worst ways, but kind of in the middle to measure like a healthcare system's quality. Like, I mean, it does reflect to a certain extent.
We don't have to talk about life expectancy. There's at least 10 others.
This is kind of like the whole thing with Cuba has a higher life expectancy, but it's not really relevant because homicides, car accidents, the U.S. was the #1 smoking nation for 40 years. Like, there's so many things that play into that. And I have several articles talking about how healthcare it doesn't play into the U.S.'s low life expectancy.
There are multiple other things that I can say.
Okay, go ahead. I just wanted to speak on that.
We have the highest rate of obesity. Americans visit the doctor less frequently and have fewer.
Okay, what does obesity have to do with our healthcare system?
People who go to the doctor more frequently tend to be less obese. But there's more to it. The U.S. has among the highest rates of hospitalizations from preventable causes like diabetes and hypertension. The U.S. has the highest rate of avoidable deaths. The U.S. has higher rates of medical medication and lab errors than comparable countries. Post-operative clots are more common in the U.S. than in other comparable studies or other comparable countries. Maternal mortality rates in the U.S. have risen over time and are much higher than in peer countries. The U.S. ranks last in a measure of healthcare access and quality, indicating higher rates of amenable mortality than peer countries. The mortality rate for respiratory disease is higher in the U.S. than in comparably wealthy countries. There's a few others, but I think you get the picture.
Yeah, I think most of those had to do with the things I just mentioned, like obesity. I don't see how.
I literally brought up preventable deaths.
Okay, let's go back to what you said. So people who are less obese go to the doctor more often, right?
I'm sure that there's some sort of correlation link to that. We don't have to.
Yeah, I know what the link is.
Health outcomes.
I know what the link is. It's because more obese people don't like going to the doctor as much.
I'd be willing to. Do you not think that people who go to the doctor and the doctor says, "Hey, you should pay more attention to your diet," you don't think that leads to less obesity?
I don't think that has a significant effect on it now.
Okay, what about we have higher rates of heart disease in other countries. We have higher rates of, like I said, lab area.
Obesity and eating plays into things like the diabetes, the heart disease. This is the same thing. And you even mentioned I'm not even going to be able to say this word. I'm sorry. I'm so tired right now. I can't say this word.
Respiratory diseases?
Yes, thank you. Respiratory. There you go. Now I can say it. I'm sorry. I'm so tired right now. I'm about to fall asleep. Okay. Okay. I'm not going to try to say it again.
I know. Diseases for the lungs.
Yeah, like the smoking, like I mentioned, right? So we were the highest smoking nation for 40 years. And so all those people, I think I actually have this right here on my phone. Actually, I can say
just out of curiosity, what do you count as measuring the health outcomes of a society then?
So I think you need to try to exclude things like fatal accidents and stuff like that, and then you can account for like life expectancy. I think once you do stuff like that and account for life expectancy, that's one thing, which that has been done, but it hasn't been done in a while. It was done last back in the 90s, and when they did do that, the U.S. came out on top of life expectancy.
I believe that multiple nations have move towards a more single-payer system in that time frame. But you know, it didn't seem like you were super stuck on those numbers, so we don't have to stay on them if you don't want.
Yeah. I definitely wish someone would do it again, like a more recent thing. But yeah, that is one thing. What else was I going into? Oh yeah, I was about to say like the smoking.
We have the second highest prevalence of HIV infection and the highest incidence of AIDS. That has nothing to do with smoking or obesity. We have high rates of teen pregnancy, and more likely to individuals are more likely to acquire sexually transmitted diseases. I already brought up the mortality rate for maternal mortality rate is a lot higher in the U.S. It says indicating higher rates of amenable mortality than peer countries. So that's stuff that could be solved by having better access to care. You know, there's people who die here because they can't afford their insulin.
Yeah, I know all about like insulin and stuff like that. I'm not for. I don't defend our costs, right? I more defend our quality. Our costs aren't good, and I'm for taking measures to reduce costs. And most of that is through competition and deregulation.
But so what do you think is a good way to measure health outcomes? Because I listed several metrics.
Like the one I said would be like life expectancy. Once adjusted for several different variables. Let me think. What else would there be? See, the thing with health outcomes is healthcare is actually not a huge factor. Like, this may sound crazy, but healthcare isn't a huge factor in a population's health. Like, yeah, it is, but it isn't. So just the little things like sewers and stuff like that play huge factors in health, and just basic sanitation and eating correctly. Like, all this stuff has significantly higher factors in a population's health. So when it comes to actually measuring healthcare quality, that's much more difficult. But you can look at things like the amount of like innovations coming out of a country, which the U.S. as far as medical innovations is way ahead of anyone else, like way ahead. And the amount of medical journals, medical studies, stuff like that. Yeah, I mean, but like the percentage. I'm not talking just like numbers, right? It's way ahead.
Per capita, we lead in medical innovations.
Yes.
Is that what you're saying? I'd be interested to see that. But we also, you know, we spend more on healthcare than any other nation. So that doesn't surprise me, frankly. And now I don't see inherently how, with a Medicare for all system, how innovations would stop. I think that we do see a fair amount of innovations coming from government. I think that we could honestly look at the military and we see the number of innovations that came from that. You can look at the innovations that came from NASA. I don't think that innovation is inherent to the private sector. I think quite the contrary. I think that it's very easy to see aspects of innovation from other areas. And I think that we subsidize innovation in the healthcare sector a decent amount, not as much as some people say, but we do subsidize it. And so
I mean, most of the stuff comes from the private sector. Like over 90% of pharmaceutical innovations come from the private sector in the United States.
Let's see. US share private. Sorry, I'm trying to look at something really fast on that. Let's see. Much of the research in the United States is funded by public money, not investment from private companies. This is coming from Medium.com. Total spending on biomedical research in 2012 was $116 billion. 44.3 billion was public spending. So what is that?
Yeah, but
that's not 90%.
You're talking about spending rather than innovation, and I think that actually works more for my argument, because if we're putting so much more spending to the public sector for medical innovations, but we're seeing so much more innovations coming out of the private sector, that just shows how much more effective the private sector is.
I'm sorry. Wait, could you rephrase that? Because I feel like that isn't exactly what I said. I was just trying to address the 90% number that you said.
Oh yeah, I was saying that you were talking about spending, right? So I was talking about the actual innovations, and I'm trying to find my actual article on this. But yeah, I was talking about the actual innovations So when you're talking about spending, that doesn't necessarily reflect on the actual innovations that come out, because you can spend a lot and not get that many innovations. And the fact we're putting so much spending to the public
innovation
sector
might be coming from private companies, but they're still like paid for like with government. Like, you know, like there's defense contractors that are private companies, but they are, you know, funded by the government essentially. You know what I'm trying to say? I believe that that's the case for not all. Don't get me wrong. It's not like there's not innovations that come from the private sector. But I'm saying that I don't believe it's as high of a number, and I don't think that 90% from the private sector truly reflects that, because I guarantee, I don't have the numbers right in front of me, but I guarantee a decent amount of that is coming from public spending to the private sector. And there's no reason to think that would stop under Medicare for All. I mean, what Medicare for All does is replacing private insurance. How would that influence the innovation aspect?
Well, I know that doctors much less prefer to treat Medicare patients.
Like, I've always heard the opposite. Do you have a source for that? I usually don't like going with what people prefer, just because I feel like that's not super tangible. But,
they like, I think it's like one. It's one. See, the thing is, like with the whole Medicare for All, is we all know it's not going to stop there, right? There's going to be significantly more regulation.
A bit of a slippery slope fallacy, don't you think?
No, I don't think so.
Then could you elaborate? Because you're just saying, because I am advocating for this, that it will
ultimately when you're putting more government control into the healthcare sector, you are going to see more interference and regulations.
I'm still trying to find out why you're saying that innovations would decrease with Medicare for All. I mean, Medicare for All really, I personally am not seeing the connection of why that would happen. I'm asking you to draw the lines, other than just saying it will just happen. I mean, can you tell me like why?
We're
talking about Medicare for All, though. I'm saying why. What you can say that maybe it would happen later. That's not a plan I necessarily support. I'm talking about Medicare for All.
Well, for example, there's like prices, right? So Medicare for All, and with the whole insurance situation, the government is going to be pushing companies to be going much lower than they want to sell their products for. And it's going to be you're going to go into an area where it's not worth them innovating and creating these products, because right now we have it to where it's so expensive to generate these products. So they have to have
price caps on pharmaceuticals or something like that. I mean, we have outrageous pharmaceutical costs right now.
Right. So if you just go, okay, price caps, that's not necessarily going to fix the problem, because they still have the high amounts of money they have to spend in actually developing these things and getting them tested and stuff like that.
And I've seen this before. You know, I don't know the necessarily the effect, but you can have incentives where, you know, there are certain caps that come in after the person who developed the drug has made a certain amount of money. So that there's still an incentive to innovate, especially in the private sector. Because I'm not acknowledging that there aren't innovations that come from the pharmaceutical industry. I think that the costs have gotten so out of control. I mean, we can see that where the profits that are being made are so much larger than what's being put into it. I mean, and I'm not sure if we see many other industries where the research and development is taking place with those kind of margins.
Oh, okay, so the thing with pharmaceutical development is it's very, very expensive. Like, we're talking, you're putting millions and even billions into a handful of drugs. And mostly the reason for that is because of the high amount of regulations surrounding the pharmaceutical industry. And they have to go through like way too many tests, really. Like the FDA puts way too many tests through a lot of drugs, and it'll actually keep them out of the market and end up killing people because this life-saving drug isn't coming into the market quick enough. All right, you know, it doesn't kill people, but, you know, it prevents their lives from being saved.
I would just like to acknowledge this is going a little bit away from what the debate is actually about. We're talking about Medicare for All. You're talking about regulating the pharmaceutical industry. I would just like to
you asked me like how that might affect the prices, or not the prices, the innovation.
But I'm saying what from Medicare for All would do that?
So I'm saying
that maybe there would be bargaining for lower prices from the government is what you're saying would do it?
Yeah, they're going to be pushing bargaining and price caps.
Pushing bargaining, right? Well, there's no price caps, to my understanding, inherent to Medicare for All. And now we also got to remember, so this is with the numbers that we talked about, that is spending the same amount when we talked about the cost of Medicare for all, that's assuming that we spend the exact same amount when it comes to healthcare. So that's assuming that these pharmaceutical companies are spending the exact same amount on research and development.
Well, are you sure there's no price caps like in the actual plan? Because that's not what
I don't want to hold on that because I very much could be wrong. I 100% could be wrong. We could assume that there is.
Yeah, I know at least they're going to be trying to like talk down prices, but which isn't inherently wrong. But I'm pretty sure there are price caps included in there.
I'd be happy to say that I could be wrong on that.
Or at least Bernie Sanders has pushed for price caps.
No, and he has. Don't get me wrong. I'm just saying, is price caps and Medicare for all inherent to each other? And I don't believe it. To my understanding, they weren't. I know that Bernie Sanders has argued for both. I'm just saying. I'm asking why, because I hear this a lot, and I'm frankly a little interested why I feel like.
So, I don't know. I could be wrong.
No, that's fine. That's fine.
I mean, that was. But
is that your only thing for like? Because we talked about health outcomes. And it seems like we talked about it for a little bit, but just innovation is what you'd say is how you measure the health outcomes of a country. Nothing to do with like what actually comes from like the people.
Yeah, I would say the life expectancy once you actually account for other variables. I would say health outcomes. I was just talking to someone else about this like today, but I'm so blank right now. Something else that would be good. Obviously, like the mortality rates of certain diseases does matter. I think you just have to.
Don't think that we should look at heart disease, hypertension, diabetes.
Yeah, I think you just have to be careful about like which disease you choose, because like when you're choosing specifically like heart disease and diabetes, which this is what places like the Commonwealth Fund do. They like cherry pick these certain ones that are worse, while like many other ones aren't.
This is bad. The American Public Health Association. Ischemic heart disease is higher in the United States.
Right, but I mean, I'm not saying like that's not where the source comes from. I'm saying this is like the stuff that like Commonwealth will like list, right?
Okay.
Yeah. Yes, because they have like their studies that say, okay, the U.S. is worse quality, but there's actually many areas where the U.S. is better quality or just on par. And if you look at like the full comparisons, you usually see like the U.S. like on a graph. Actually, let me see if I can just pull up the graph.
What would that graph be looking at? Now I've heard there's some like minute examples of cancer that maybe we do a little bit better on. I think with more.
Most cancer we do better on.
With what?
Most cancer we do better on, and it's because private doctors are held more accountable than places like the UK. So if they like misdiagnose someone and say they don't have cancer, and the person ends up dying because they found it much later,
I think that directly contradicts. The U.S. has higher rates of medical, medication, and lab errors than comparable countries, and these are countries that have socialized medicine. The post-operative clots, mistakes obviously, is more common in the U.S. than in other countries. So I think saying that we're more accountable here in the U.S. Isn't necessarily true, because places with socialized medicine have less of those things.
Medical errors, but I mean, we're like 1% above. It's not like a significant difference.
But we're still worse than these places with socialized. I mean, some of these places have fully socialized medicine. I mean, we're doing worse than the UK, which has fully socialized medicine. Those are government-run hospitals, government-run doctors. I mean, that's not even what Medicare for all is. There'd still be private institutions with Medicare for all. It's just the funding would be, the government would be the payer.
The medical malpractice isn't something I've looked into a whole lot. I'll definitely take more of a look at that. But what I was saying was, in the U.S., it's usually like, just because we have a higher amount of medical malpractice doesn't mean people aren't held accountable. Because like that's the entire reason that like the UK has such a high mortality rate for cancer, because
it's certain types of cancer. It's not all.
In the U.S., people will just sue the doctors if they get misdiagnosed, and that's why the doctors like are pushed so much to find cancer in the U.S. Because if they miss it, then they can get sued, and that's what I'm talking about, like with accountability.
No, I've only ever seen this for specific nations. I'm looking at something. This is the American Institute for Cancer Research, and it has the U.S. when it comes to all cancers, at, let's see, where are we? Definitely lower than you would hope. We are we even on here? What the heck? Well, on this, we don't even make the top 50 when it comes to all cancers.
Huh?
This is.
That doesn't sound right. That doesn't sound right.
Frankly, it doesn't sound right. Frankly, it doesn't sound right to me though. This is the American Institute for Cancer Research. Doesn't even have the US on here. Here, I'm gonna link it in the chat. Here, we can look at it together. I'm literally just looking at this right now, just because I was trying to find the numbers you were saying. Yeah, I looked at it wrong. Oh wait, here we are. Never mind. There we are. I typed in United. I control F the United States when I should have looked US. Oh, we're number 5, and all the countries above us have socialized medicine.
Age standardized group. Yeah. So this is cancer rates right here. What else do we have? Cancer rates. Yeah, this is cancer rates. The link you sent me. It's not mortality.
Let's see. Cancer rates. Let's find it. Why isn't it having cancer survival rates? Well, do you have something for all cancers, not just specific?
Let's see. Okay.
Because I know there are some things that the U.S. does do better on, such as cervical cancer, I believe.
For instance, it's just this. I wish I would have had that ready. It's just this certain thing is hard to find. Like sometimes, it's just hard to find these specific graphs that you want.
No, 100%. No, 100%. Now that's just cancer, and I think that there's a reason to think that if people could get more preventable care, which some of that, some of these are a little generic, but I mean, in this Commonwealth Fund, it says the U.S. has the highest rate of avoidable deaths. Now, I'm not sure exactly what they're measuring. I can read into it more if you'd like. And then also in this other one from the American Health Association.
What would be your most ideal system, like looking at other countries?
Frankly, I think that I think that the NHS has some problems with it, and I don't think the full socialized system would work. What's most important to me is that people aren't paying anything at the point of service, and that's why I really like Medicare for All, frankly. And it hasn't really been replicated in many other countries. But I mean, honestly, any form of universal healthcare I think would be better. I mean, even Singapore, which doesn't have an ideal system in my mind. I mean, even Singapore would be better than what we have currently. Now, I think that Medicare for All would be better, but I think that Singapore has a better system than what the U.S. has currently.
Yeah, I mean, I agree with like a somewhat Singapore type system as like a transition system, because you can't just like drop a free market system overnight and knock people off of all these government welfare programs. So you do have to have like some sort of transition, and during that transition, be like deregulating and getting drug prices and stuff like that down cheaper.
Now, do you that's interesting that we both think we probably both like Singapore's model for different reasons. I like it because even if you're poor, you're still going to get healthcare in Singapore. But we can venture into the morality if you'd like.
Do you have any more, like, do you have like a certain example, like what would be like your favorite healthcare system?
To my understanding, Denmark is run very. I don't necessarily have a favorite. Like I try to think of what's realistic for the United States. Medicare for All seems to be what's more realistic for the United States. But to my understanding, Denmark has a fairly successful healthcare system. Most of Scandinavia. But I mean, I'm not going to choose just one country. But for the sake of it, we can say Denmark.
Okay. So Denmark isn't single payer. It's an opt-out universal system.
That's why I say universal healthcare.
Right. So they don't cover illegal immigrants, while Medicare would cover illegal immigrants, and that's actually something that's included in a lot of our healthcare statistics, which I didn't mention before, is illegal immigrants. Like
I think that even if you're born in another country, I think that you deserve healthcare.
Let's see. And Denmark does have private healthcare, while Medicare is for outlaw, basically getting rid of private insurance over time.
Could you say that one more time?
Denmark does have private healthcare as an option, while Medicare for All is for getting rid of private insurance over time.
Yeah, their private healthcare is a little interesting because it's a supplemental care. For example, if you go and you get hit by a car, you will be covered. But if you have the supplemental insurance, then you would get like extra money. It's similar to how they have free college, but they also have it where they subsidize people while they're in college. Like they give them money to be in school.
It's not working.
Everybody in Denmark has a base level of care that they are given as a right, and there's supplemental insurance that people can purchase.
I'm having some problems with my doc. It's not searching for the Denmark section. That's weird. Okay, but I do know that over the last few years, there have been a lot of people moving away from their public option and going towards the private option.
I think that that's frankly one of the reasons why I support Medicare for All is I think that if you have that's why I don't like a public option is I think that no, it's better than what we currently have. But when you have a public option, there's going to be all the sick people are going to go on the public option, and then healthy people that can afford it are going to go to the private option. It's going to make it look like the public option is not as successful. That's why I prefer Medicare for All for reasons that.
My doc hasn't been working. It won't let me search anything. This is really annoying. So we can move on to the.
Yeah, you don't need a doc for morality. Yeah, we don't need any sources. This is where it gets fun. We don't need any sources for this.
Okay, so obviously my position is I think taxation is theft, and so I don't think. If anything, we definitely should be increasing taxes, and I don't think it's the responsibility. It's an absolute obligation for people to pay for another's healthcare.
So before we go quite into the taxation part of it, just because I mean that's more broad than just healthcare. That is, you think all taxation is theft, not just taxes for healthcare, correct?
I wouldn't say all taxes. Just like the income type tax, there's some sort of.
Wait, you support a sales tax?
No, not sales tax. There are some types of taxes that can be justified, like pollution tax.
That's interesting. I would love to hear your rationale for that. But before we get into the taxes, so for example, I'm sure that you don't support if someone is injured and they go to the hospital and they don't have healthcare, you don't think that the hospital should have to cover them, correct?
No, I don't think it should be required.
So you think that person should die because they can't afford it? Now, I'm not trying to strawman you or anything. I'm just curious. And these are the terms that
I don't think they should die. No.
No, and I don't think that you think you should die, but you don't think that the hospital should treat them. And as a byproduct, they would die because removing that regulation would mean that they would die.
I don't think the government has to force the hospital to treat them. No, that's my position.
So, but you are comfortable with a system where there would be people that die because they can't afford care.
Well, that's assuming the people will die because they can't afford care. Because I'm still for
against that regulation, but I'm sure we can think of a hypothetical.
I'm still not for profit hospitals. I'm still for charity. I'm still for mutual aid.
Yes, but I think that the charity that exists today, we know that there are people that would die if they didn't have because they can't afford care. Now there'd be some people that would be picked up by charity, but I'm just saying because with my system, I don't think anybody should die because of that ever. And so I'm saying with your system, you are comfortable with a system where someone dies because they can't afford healthcare.
That's a bit of a loaded question.
I'm trying to be frank with it. I mean, I'm comfortable with people being taxed. Being taxed at 90% of their. I'm perfectly comfortable saying that. That's 90%. That's very high.
This is what it would be like if I talked like that, right? So, let's say
I'm comfortable with the government coming with a gun to make you pay taxes.
This person is going to die because their wait time is too long because of this socialized system. So you're for people dying while they're waiting. I wouldn't say that because I know you're not for that.
Well, no. I think that is fair to say. I am comfortable with a system that prioritizes based on need. And if because of that, if there is an overwhelming of need and there are certain people who, because they are at the back of the line, and just because they can't afford to pay more, that they would die as a byproduct because our system got overwhelmed for some reason. Maybe we had a pandemic and we had a single payer system and not enough people could get to the care that they needed. I am comfortable with the system being based on a line and not on how much money you have. And so, yes, I am comfortable with that situation. I don't think that it should be based on I don't think that whether or not you die should be based on how much money you have. And so I am comfortable with that line.
So like I mentioned, non-for-profit hospitals, mutual aid, charity. And then also, I don't believe that most hospitals would just reject people and let them go out and die, because you do want to have your customers. And if you're that hospital that's
why would they want that person if they can afford it?
If you're that hospital that's known for kicking people out and letting them die, people aren't exactly going to want to go there.
I think the elasticity for the demand for a hospital is very inelastic. I think that people either need a hospital or they don't.
Well, you have much you have like monopolies now in certain areas where you don't really have an option, but that's largely because in some areas you can't build another hospital unless you get the permission of an existing hospital, which is kind of dumb because why would a hospital say, oh yeah, put in a competitor for me?
If there are certain rural areas where it stands perfect reason that there would not be very many hospitals in that area, probably just one in some areas. I'm sure we can find towns where it would just not be profitable to have just one hospital in that town, right?
Mm-hmm.
And if that one hospital says if you can't afford it, you don't get healthcare. And so that person would, now I'm saying, are you comfortable with that being something that can exist in your system? It is not something that can exist in my system. You brought up the line thing. I'm comfortable saying that. Are you comfortable with saying that that's something that would exist in your situation?
Yeah, I mean, I'm not for the government forcing to do that. So if some people would die because I mean, obviously that would happen at some point. Like I'm not saying it'd be perfect every single time.
Okay, we're talking about the morality.
Overall, I'm more comfortable with that system. Yes.
Okay, all right. I just think that that's something that's important to get out of the way because I think that that's one of the good things that our healthcare system does. I think that the hospital has to treat you whether or not you can afford it or not. I think that's a really, really good thing. And I know that that's not something that you support being a thing. And so,
I support there being more hospitals actually being able to exist. I support
but that's not
more
what
doctors.
I'm talking about that specific regulation. You know what I mean? That's like, I think it's important. Now let's talk about taxation. So on what grounds do you think that taxation is theft? We can Google theft, we can Google stealing, and it says without legal right. Now we have the legal right. The government has the legal right.
I just think that's kind of a silly definition to go off of. Like,
I think it's legality. I mean, it's not like I came up with that definition.
Like, okay, the government makes it legal for like me, one person, to go inside anyone's house at any point and take anything. It doesn't just suddenly make it not theft. Like, okay, it's legal. Like, it's not legally theft now. It's still theft. Like, we all know it's still theft.
I think that there are maybe
it's the same thing with people who.
I think that their words have definitions, and
it's the same thing with people who try to use murder as like the literal like first definition that comes up on Google. Like, if I go and kill someone without probable cause and it's somehow legal, that doesn't mean I just didn't murder them. It just means I didn't legally murder them.
Well, then we don't want to go with the definition of theft and stealing, and that's fine. I'm sure that there are some definitions that we can point to where I'd say I don't like that definition either, and so we don't have to do that.
I could probably find some definitions on theft. Like, I mean, the first one that comes up on Google, I think, is right here.
The Merriam-Webster Dictionary.com. I genuinely trust the dictionary.
Dictionary.com. It's just like the act of stealing, wrongfully taking away personal good or property.
And so we look at stealing. It's taking without permission or legal right. Is that not what it says for stealing?
I'll have to go on it. Stealing. The act of a person who steals. You got to go down the rabbit hole. Take the property of another person without permission or right, especially secrecy. So yeah, I mean, there's one definition. So I can say
but I have more to it though. Why I also don't think it's theft. I think that when you're a person and you go to decide to work at Starbucks, you are consenting, but when you sign your labor contract, that you are going to be paying taxes. And so I think that there is an implicit consent that comes there.
Well, in that case, that's a contract you're forced into making, right?
Oh no, no one made you go work at Starbucks today.
No, they made you pay taxes on Starbucks.
Though. Well, no, but no one made you. Well, no, I had this discussion with him. I'm curious. So if someone is in the desert and they're dying of thirst, and someone comes up to them and says, "Hey, if you sign this contract, you have to be my slave for the next 30 years, but I'll give you this water and you won't die of thirst anymore." Do you think that person is voluntarily signing that contract?
Yeah, they're voluntarily signing the contract.
But you don't think that they're voluntarily going to work at Starbucks?
No.
Person died. No.
Wait. They are going to voluntary work at Starbucks. They aren't voluntarily paying taxes.
Well, no. But they signed that contract, and unless I'm advocating people read their contracts, of course. In that contract, it said you'll pay payroll taxes, and it said that you'll have federal withholdings. Now I don't know how much you're making at Starbucks, or you're actually going to pay income tax. But payroll taxes you would be paying, and you sign a contract.
Why does the government have the right to just put their own thing in the contract and force?
Why does that person have the right to tell people that they get to be their slave for 30 years? That's not the point. We're talking about from the point of view of the person signing the contract, aren't we? I'm saying, are they voluntarily doing it or not? You said the person in the desert is voluntarily doing that. Can you justify why that's a voluntary thing? Because I think that they are not acting of their own free will in that situation, but you're saying they are.
Yes, you are acting of your own free will. That's how free will works. If you make the decision to either die or sign the contract.
Well, actually, free will, I believe that it is without the necessity of the definition
in
of
this
free will.
case, you are getting something from the person. They are offering you something, and you are specifically getting that thing they are offering voluntarily. In the other case, you are pursuing something from a third party, and then the government says, "Oh, but you also have to give us your money here, or else."
So there's three people in the desert. There's the guy with the contract, and then another guy made him put something on the contract, and it says, you know, you have to be my slave, this guy's slave for a year also. And we can add a third party into it. Is that person, or are they not voluntarily signing that contract in the desert?
So they're not voluntarily choosing to be the other person's slave because.
Well, if they sign the contract, well, no, wait. Now, didn't you just say if it's in, you believe in contract law, don't you?
Yes, I believe in contracts.
So if someone signs a contract, aren't they held to that contract?
Yes, they are held to that contract.
And I'm sure you really. I mean, that's what you do when you go work at a place. You sign the contract.
If the other person has used force to force the third party into putting him on the contract.
Now, nobody made Starbucks open up that store. Starbucks also had a contract.
Okay.
But
I wish I had a freaking whiteboard or something. Okay, so in situation one, you have two parties, right? One party has something that the other party wants. So party two.
But keep in mind, they have no choices in the desert. They have no choice. It's die or they sign the contract.
So that's a choice.
Well, actually, technically, the definition of free will means to act without the necessity of fate, which means you dying is not an option.
That's still a choice. Okay.
Well, no, but I mean that's not the definition. Definitionally, that's not free will, though.
In this case, you have two parties, right? So party one has the utility or whatever the person wants, right? Party two wants it. So party one, like, this belongs to them. They can do what they want to it. So they're saying, okay, can you do this certain thing and then I'll give you what you want. So then it's a mutual agreement between them both. But if you add a third party that comes in and the third party forces the second party to add in something extra, and also the first party has no say in it, then that is force.
Now, the third party has much less of a say with the desert option. The person signing the contract has much less of a say than you do in the world today. No one's making you come work in the U.S.
See, even if I like granted to you that the certain person wasn't being forced into it, but now I can say the business is being forced into it because they're nobody made
them open up that Starbucks. Did someone go and say, "Hey, barista, you got to open up this Starbucks or whatever"? Did anyone do that?
What does that have to do with the argument?
Did someone make them sign that? Because when they opened up the Starbucks, they had to sign some contracts, didn't they?
Just because you start a business doesn't mean you should be obligated to pay the government money.
Well, but you believe in property, right? You believe in contracts, and you believe if you start a business and you sign a contract, then you are held to that contract. Right? Nobody made them start that business, did they?
You're being forced into it. That's my entire point.
Now, who's forcing them to start the business? Nobody forced them to work at Starbucks.
No, they're choosing to start a business. They're choosing to start a business, and the government unjustly, on their own private property, forces them to pay.
This person decided to start a business on the sovereign land that is considered the United States.
On their own private property.
Nobody made them.
Private property.
And the only reason that nobody comes and builds something else on their private property is because the government enforces their right to that private property.
So?
What do you mean? So that they are just nobody is making that person start a business right there. They have every right to go to another country, don't they? Now that's more of a choice. Now I'm personally not someone that likes that argument, but when you're saying that the person in the desert dying of thirst, that they're making a choice, I have a hard time saying that someone that starts a business doesn't have a choice.
Okay, so let's look at it from a different perspective, right? So you got this town, right? Let's say Chicago, and I need to go there and start a business. But the only place I have to start a business is on mob territory. And now I'm in Chicago and I don't have the money to move out. I can't get a job. I have to start this business. But this mob is going to come in and say,
do you elect the members of the mob? Do you elect the members of the mob?
We don't elect the members of the government. I never elected anyone.
I'm assuming you're under 18 then.
No, I voted. I haven't elected anyone, though. The only way I can elect someone is if it's a tie and my vote is the deciding vote.
We vote. Okay, I can rephrase it. Did you vote for the members of the mob? Were you given a ballot where you could choose who is in the mob?
But that's irrelevant because what if there is what if you voted for the mob members that wouldn't steal your money and the other ones get in?
Well, you decided to live in this territory, though.
Because you have no other option. That's my entire point.
No. Wait, you said because you have no other option. I brought up the desert example because of this, because you're saying that person is making a choice.
Yes,
they have less options.
And in that case, like the business doesn't belong to the mob, right? That's the whole point.
No. We're talking from the perspective of the person signing the contract, are we not? Are they voluntarily making the decision, or are they not? There's a paper. They have a decision
to go to. They're making that. There's no contract with the mob, right? They make a contract with someone else to have the business there.
Well, then there's I think the mob is an absurd example when we vote for members of our government. You don't vote for people.
I don't think it's an absurd example because just because you vote, that literally means nothing.
What do you mean? There's a whole thing. The founding of this country was no taxation without representation. They wanted to be represented when they paid their taxes.
And I'm for no taxation. I disagree with it.
You're saying that the act of representation isn't relevant. I'm saying if you're going to use this example, these people aren't being forced onto you in the same way with your mob example.
I wasn't there when they founded the government.
No, but is anyone making you stay?
Yes.
Who?
Do you think I can go walk across the border?
Well, now there's outside parts. Those don't matter. I'm saying, is anyone making you stay? Is the U.S. government making you stay? I can rephrase. Making you stay.
You do realize it costs money to revoke your citizenship, right?
Well, if they find you and they have a problem with it, but nobody is making you do it, though, are they not? And now I'm sure also
you can still have to pay taxes even if you move out of the U.S. and you're still a citizen. You have to revoke your citizenship to completely get away from it, and that costs money.
How much does it cost? I'm sure
it's like $3,000.
That's far less than what you receive in public education.
It's irrelevant. It's money. Even if it costs $1.
What'd you say?
I mean, it's irrelevant how much money it is, even if it's $1. That's still
absolutely relevant.
Just for you not to be under their jurisdiction, you have to pay to not be under their jurisdiction.
But you are still choosing to do it, though. In the other one, you pay with your life.
Well, I mean, in this one, you can pay for your life because if you don't abide by what they want, they can kill you.
No, they don't.
Yeah. Okay. So,
pay taxes.
What happens when I don't pay taxes?
Well, it's actually a civil offense. Now, there are so many things that can go wrong along the way that you probably would eventually go to. But just to be clear, the simple act of not paying taxes is just a civil offense. The criminal offense comes if you commit tax fraud or something along those lines. But just the act of
if I don't pay taxes and I continue to not pay taxes, eventually they are going to try to put me in jail. If I do not go to jail, then they're going to kill me.
Effectively, you will probably do something wrong along the way that makes it become a criminal offense. But just the act of not paying taxes is a civil offense. Just to be clear.
So if you keep not paying taxes, eventually they are going to take you to jail.
If you do everything else right and all you do is not pay taxes, that is a civil offense. You cannot go to jail for a civil offense.
If you never pay taxes and you continue to not pay taxes, even if after they go on to you about paying taxes, you will go to jail eventually. Eventually, it will no longer be a justice.
Everything else that is asked of you, and the only thing you do is not pay taxes. That is only a civil offense.
So you think the government will never put you in jail if you never pay taxes?
If all you do is not pay, if you fill out the paperwork, if you do all the other things, it's just the not paying taxes, then you will still. This is obviously a semantic thing. But what I was trying to say is that you're trying to get down the line is that eventually you'd go to jail. Even if I secede to that, that's not true.
If I don't go to jail, then they'll kill me. If I resist going to jail,
they won't. They have way. They can just. They're not going to just shoot you down because you decide not to go. Do you think that's what happens?
If you continue to resist arrest and don't allow.
If somebody resists, they will try to subdue them. They won't just gun them down.
You don't think people are gunned down resisting arrest?
There are people that haven't, but just the act of if you're just flailing around, it is very possible that you would not be shot along that way.
That's a possibility. Like, I mean, I'm not saying it happens every single time, but just if it's a possibility, I can get shot for not paying taxes.
It is not within the protocol that someone would be gunned down. That is not within the realm. If somebody hasn't paid taxes and all that they do is if you don't exert any force or anything, if that's all that you're doing, and you get gunned down, that is not legal. That is not within the realm of what the government does. They don't just shoot people for not paying taxes.
But that's irrelevant. I'm just saying I could end up dead for not. I could end up shot for not paying taxes.
Just be clear though, but that person in the desert though, who 100% would die, that's voluntary. That's all voluntary.
Yes.
And you see no contradictions. You see no, and just out of curiosity. So if you saw that person, so 10 years in, it means like if you met that person and he's walking around, he's got someone carrying his boat. You're like, hey, what's this guy? You're like, oh, he's my slave. I met him in the desert. I made him. You would view that as moral, but if you see the government paying collecting taxes, you view that as not moral. Just
see, there's a difference between like
I'm assuming
something,
that person, so that's a good thing.
Unethical, but something that can still happen, like within rights, right? So I can disagree and say this is an unethical thing. Like I can say it's unethical to watch porn. It doesn't mean I think we should ban it, right?
That's fair. Do you not think slavery is unethical or wrong, immoral?
So as far as like voluntary slavery goes, I'm still like working on my opinion on that area. Like maybe I would be for him not being able to sell himself into slavery, but there's possibly other things. I'm still working on that area. That's a very complex philosophical thing when it comes to like libertarianism, like the whole voluntary slavery debate. It's like a very controversial debate among like libertarians. So I still don't know my exact position on that and like how exactly a slave would have to be treated as being a slave if they were a voluntary slave.
Just out of curiosity, in this, say that you're okay with it, but there's certain standards of how you're supposed to treat them. With your ideology, it's not like there's someone that enforces that.
What do you mean?
It's not like there's like a governing body that enforces whether or not that person is treating them up to code.
I'm a minarchist. I'm not an anarchist. I'm a minarchist, not an anarchist.
You do support a government. So I'm actually interested now because what are the taxes that you support? And I don't see how that doesn't also fall under the theft.
Yeah, so for one, I do support like a pollution tax because with pollution, you're actually affecting other people's property and bodies. So in order to like put this factor here and have all this pollution coming out, you have to have some sort of contract with the local or federal government, or it's just the people in that area, and pay taxes on that or give some sort of compensation for how you're.
Libertarians are usually against environmental regulations, aren't they? Would you say that you're like
they're not against environmental regulations?
There's definitely some that are, though, right?
So they're for environmental regulations that are based off of private property, and this is the idea. Like, okay, if you've got like smoke coming out of your factory over here, and it gives me asthma or something, then you've affected me, right? This is your thing. You have your property over here. The air isn't your property. The air isn't something that can actually be owned. So you're now affecting me. So yeah, you can have a regulation with that.
So what if they just pollute the commons?
Huh?
Obviously public. I'm not sure public areas exist in your minarchist society, do they?
Very little, just like buildings.
But if those are polluted, those are not private property. Do you issue with that or no?
Huh?
Do you have if they pollute public land? Is that also not allowed in your society?
Oh, yeah, because it's owned by the government or kind of collectively by the people in a way.
So how would this government receive funding? Besides like what would they do? What would they do with this funding? Like what do you support the government doing? A police force?
Yeah, so that would be one thing. The pollution tax. Another thing, would be you would definitely have a voluntary donation system. You could also have a system where citizens pay a certain amount to actually be like covered by the government to be like citizens, right? So if you're a citizen, your basic rights will still be protected. Like someone's attacking you, I am going to have like a police officer stop them. But like, so let's say
not a citizen, the police officer wouldn't.
Huh?
If they're not a citizen, the police officer would not help.
No. If they're not a citizen, then the police officer would still help because that's still like the person is under immediate threat and they should be protecting their rights. But like, let's say someone like steals your car and goes across the country, then maybe in that case you wouldn't have like a detective for free going after them, paid for by the government. So I think.
So I would be able to steal someone who's not a citizen. I would be able to steal their car with no legal ramifications.
Hmm.
You can say yes if it's yes.
Trying to think how exactly that would work. I haven't thought about that particular situation. Like I just came up with that particular hypothetical, so I haven't really thought about it a whole lot. But I think you can still like put the person in jail like this is a thief, right? But like you're not going out of your way to like get the car. But like maybe you could still get the car back to them, but this isn't like a priority to serve this person, if that makes sense.
It does to a degree. You know, I obviously don't think that's a
I'm
good
just kind of throwing out ideas, like different ideas that have been theorized for funding America's government.
Okay.
There's lots of different theories on it. Like personally, I think the just the pollution tax and the voluntary donations would be just fine. Like I think people would be just fine donating money to the government, and it's not like the government would be nearly as big as it is now and would need nearly as much money.
So just the police, is that all they would do, or what else would they do?
What's that?
What else would the government do? Just a police force?
The police force, the military, and courts. We're way off subject. We were talking about.
Yeah, we really are. Well, do you have anything else you wanted to say about healthcare, or should we wrap it up?